Do these sound bites sound familiar? Where's the report? The meeting's tomorrow already. I'm sorry if I'm sorry for the rush, but could you please come up with a presentation by the end of the day? When things are going too fast, take a break. Catch up on the hot topics and issues of the day on the Manila Times Coffee Break. Enjoy the perks of Coffee Break on the Manila Times Facebook page. I'm the Fort Villaseran. Please do join us.
Good day. Thank you for joining us today with the Manila Times Coffee Break. And our topic today is strategizing for better cancer care. Joining me is Dr. May Dolendo and Ms. Carmen Auste, who will be speaking regarding the latest developments in terms of cancer care in spite of the ongoing health and financial crisis. Dr. May Dolendo is the head of the Children's Cancer Institute for Southern Philippines Medical Center, and she is also the medical lead for St. Jude Global Alliance Partner Institution in Davao City. She is the program leader for World Child Cancer Project Philippines. At the same time, she is also a core leader and founding member of the Asia Childhood Cancer Alliance. Most importantly also in terms of the everyday experience for cancer patients and cancer survivors, is that she has been key in helping to craft the implementing rules and regulations for the National Integrated Cancer Control Act, or NICA. This is Republic Act 11215. Hello, Dr. Dolendo, how are you?
Oh, I'm good. It's nice to be here, and it's nice to share with you what's currently in the landscape of cancer care in our country.
Mhm.
Thank you for having me.
Yes, it's we know you're very busy, and we're grateful for the time that you want for you to be able to share with us the current state of for those who have loved ones who are they themselves undergoing this condition. But I also understand that in your family you've also had a personal experience with this that kind of helped prompt you to become a specialist in the field.
I was orphaned by cancer at the age of 17. My mom died of breast cancer. And maybe it explains my passion and advocacy for cancer as a whole, not only for children, but for cancer as a whole.
Yes, when I heard that story, to me it resonates and it makes sense that somehow that you were, and it's something actually it's hopeful for our listeners, particularly those who do have loved ones who are experiencing this, because there is a way to positively channel all the anxiety, and there is a lot of help. There is a support group, and there are specialists in the field who understand what you're going through. It touches the heart for all. uh, including even Ms. Carmen Auste. I do understand that for those of us who might not be familiar with her background, she is the mother of a childhood cancer survivor, and because of that, she became the past president of the Childhood Cancer International, or CCI, which is the largest global patient support organization and advocacy network for children, including adolescents with cancer and those who have survived it. Currently, she is the vice president and co-founding member of Cancer Coalition Philippines, which successfully spearheaded the passage into law of the aforementioned NICA Act, or National Integrated Cancer Control Act. Hello, Ms. Auste, how are you?
Hi, how are you, the fourth? So
Yes,
good to be here with you and with Doc May as well.
yes. If I hope you'll forgive me for the mouthful of introductory information that I have to give to all of you, but I do note that your backgrounds are both very impressive and both very thorough in terms of all your experience and how you've helped a lot of people in terms of cancer care.
Actually, it happened because, as you mentioned, my son is a childhood cancer survivor of a very rare type of brain cancer. And it was actually him who wanted to organize the Cancer Warriors Foundation so that other children in the Philippines will have the same opportunity that he had to fight cancer and to have a second chance at life. And so that's why it's been now 21 years that we've had the Cancer Warriors Foundation. And in 2017 is when we then got together for the Cancer Coalition to push for the passage of that much needed law.
And uh, over 2 decades worth of experience and fighting as cancer warriors have actually led you to the international arena. I do believe that you're also involved somehow with the World Health Organization.
Yes, we saw that it was not enough for us to be doing advocacy work in the Philippines.
Mhm.
That really, if we were to rewrite the future and the journey of children with cancer, we needed to be able to put it in the international development and child health agenda. So that's why we joined Childhood Cancer International. And
Mhm.
from there, we started advocating to the World Health Organization. And the good news is, as of 2 years ago, we have now put in, and there is now a global initiative for childhood cancer, which intends to raise the survivorship of children and adolescents with cancer to at least 60%, because in advanced countries, high-income countries, it's now up to 90 or even 95%. And in the
There's
Philippines, we have areas where we're still on 20 to 30%, but in other areas like that of DOCME and Cancer Warriors, we have already reached from 70 to 80%. So there's good news there as well.
Mhm. Yeah, that is encouraging because we can see based on the information that with the strength in advocacy and knowledge and cooperation, there is a direct correlation between the percentages of survivorship.
Yes, because just like with Doc May and all of our other doctors as well, both in pedia and in adult oncology, there's ongoing collaboration and twinning programs with other countries that have more experience or more advanced technologies, and they're able to provide both the guidance and the support for us to be able to have better care and also more cures for all types of cancer.
So taking your interactions with Geneva, with the World Organization headquarters, and all your interactions and meetings with them, you take it also now to the local level, right? You are chair of the Committee on Patient, Family, and Stakeholder Engagement of the Philippine Health Research Ethics Board.
Yes, and we're also part of the National Advisory Council for Medicines.
Mhm.
And during COVID, we advocated and we were able to put together an interagency task force for
Mhm.
medicines, devices, and supplies. And the good news is these are all the heads of various government agencies in the private sector. And because it's a Viber group, it's like a 724. So you have patients somewhere that needs medicine or something that needs to get to somewhere, and these people really facilitate it, and I've seen it in action, and I'm so impressed by the dedication of everyone during this period of COVID.
It does seem like for the average Filipino, the whole cancer care landscape has just kind of gone silent for the national consciousness. For those who are constantly part of among the stakeholders, it's for some at least it has been a question mark in their minds about what's going on and how things are evolving along with the current condition, the pandemic.
The fourth, I think that's where we come in.
Mm-mm.
Delivery of care in the country is really fragmented, and it's not the same all throughout the country. There are still places that do not even have access for basic care, much more care for cancer. We look at places, well-developed places in the country where you have state-of-the-art care for cancer, but that is not what is happening to the rest of the country.
Mhm.
And I think it's beautiful that the Republic Act 11215, or the National Integrated Cancer Control Act,
Mhm.
was signed into law. You know, there are many countries around Asia and even the world who have national cancer care plans, but it's only in the Philippines and in few other countries wherein the national cancer care plan is embodied in the law. And so this is what inspires all of us, but at the same time, we would have to have a certain pragmatism in how we can implement this law, because there's so much aspirations into it, but in terms of implementation, I think there are a lot of areas that we need to work for. And we're here make that happen for our people. I trained in Singapore as an oncologist.
Mhm.
You probably saw that in my bio sketch.
Yes.
And I was very impressed on how, when I was training as a pediatrician, I was very concerned that I hardly see any survivors for cancer. And the facilities are really very, there's lots of gaps. And I was very impressed when I went into training when I saw survivors, and I thought, how can I bring this back to the Philippines? And I bring with me the wealth of 16 years of experience of building Children's Cancer Institute from the ground up.
Mhm.
So Southern Philippines Medical Center currently is the end referral center for pediatric cancer and many cancers and even adult cancers in Mindanao. So under the law and under Republic Act 11215, we have been designated as the end referral center for cancer. And we're very happy that our experience in working in limited resource settings has served as a model for many areas. And we're hoping that we can share this experience and provide access for adults and children across the country.
I know that you are very active, especially outside Metro Manila, throughout the Philippines and in the South in particular. You are doing a lot of training for regarding oncology information and knowledge to be able to disseminate all that wealth information you've accumulated for all those years.
Well, I think there's the knowledge is good, but application is more important. And our experience as every part of the country is going to be different. The strengths and the weaknesses,
Mhm.
where people are going to be different, and so the strategies have to be designed in such a way that they respond to certain areas. And in the recent Economist meeting
Mhm.
of stakeholders, we discussed about the National Integrated Cancer Control Act. And basically what was discussed is, what is the implication of this law to the common people? How is it related to the Universal Healthcare Act? How do we implement it? How has COVID affected the implementation of the National Integrated Cancer Control Act? And what are the challenges and possible strategies, particularly in financing, that we can do so that the law has, particularly in its declaration of policy, it has the intent of the law is very beautiful, and it is to provide access to care for all cancer patients, particularly the marginalized, the poor, and the underprivileged. We know that cancer treatment is very expensive, and by personal experience, I know how devastating it is to families, particularly not only in the loss of a loved one, but also in the whole economic sphere of trying to bring cure to a family member. So this is my understanding that I am bringing into this discussion.
How have the government agencies been able to help in the funding of the law? I do understand that given that there are interagency task forces, and there should be at least on paper the more seamless interaction between government departments and agencies.
No, I think it's very important. Before I answer that question, I think it's very important for us to understand what are the problems in implementing the law.
Mhm.
The Philippines has a lot of beautiful laws, well-crafted laws, and I believe that the National Integrated Cancer Control Act is one of them, because it is comprehensive, it is integrative, but there are going to be challenges in its implementation. Number one, if you look at the Philippines as a whole, uh, one of our biggest challenges is our geography.
Mhm.
We are, an archipelago of more than 7,000, 400 islands. And in terms of dialects, we have more than more than 80, and it's very difficult. Implementation requires communication, very efficient communication. So by that alone, it's tough. Number two, we need intelligence or data. We need to know what we are facing. What actual we don't have. We only have a population-based registry for Metro Manila and the Rizal province. We don't have that for the rest of the country. And so that is a challenge.
In terms of metrics, you did mention that we need data.
Yes.
Is there some, could you touch upon perhaps the index of cancer preparedness? Is that something that can help in the strategizing and implementation of the NICA law?
Well, that's one of the other conversations that we have had, and I was very happy to be part of that conversation with economists. And the Index of Cancer Preparedness looks at countries around the world. So there's another index that we're in. Australia came on top, and then there's one that looked at Southeast Asia, and we're actually in the bottom of we are number 10 out of 10. But for me, that's
in a way that's a good thing, because
that's a good thing. For me, it's a good thing because we were never there before. We were not even number 10. And for me, I'm a pediatric oncologist. We have nowhere to go but up, right?
Exactly.
I think that's a very good thing. And it's good that the Index of Cancer Preparedness serves as a benchmark. It might not be a very complete sort of benchmark, but we are able to see where we are, and I think a lot of it is because we had the NICA law, and that's the reason why we were included in the top 10. And one of our strengths is actually our multi-stakeholder participation, and that is where the Cancer Coalition and the CCI, that's where all of the NGOs come in, and that was what brought us. I think in that portion of the ICP, we were number 9. So I think that's for me, that's a good thing. We have a goal that we can move up to, and something that we can all work for. And then going back to the implementation of the NICA law, the other thing that I see as a challenge is that we have a fragmented healthcare system. The Department of Health is working very, very hard. We have to give it to them, but there's a lot of need for efficiency and governance, and I'm saying this objectively and dispassionately.
Okay.
Being able to see and to find examples across the region. And so that is something that we need to work for. And finally, of course, financing. The conversations, the good thing with NICA is that it establishes a cancer assistance fund. And this cancer assistance fund can actually raise funds for cancer. And apart from this, there are other things that we could get funds for. We have field health, and the thing is, we look at the cancer law as separate from universal healthcare law. It is not separate from healthcare law. They have common things in between. And basically, the spirit of NICA is also the spirit of the universal healthcare law. And this is basically allowing every Filipino access to care. And in cancer, that is basically giving every Filipino the chance to fight cancer, whether you are a child, whether you're an adult, whether you're early stage or late stage. It's just giving every Filipino a fighting chance for cancer. And I think in that sense, it is beautiful. But we have to have our acts together. We have to know what we are looking for. We have to be methodical, evidence-based, and that is why I believe that it's very important for us to have intelligence data, a registry, not only population-based. In Thailand, for example, they have 4 population-based registries, and they found that the types of cancer that they see in northern Thailand is very different from the kinds of cancers that they see in central Thailand. And I think that we can bring this to the Philippines if we know the kinds of cancers. I'm sure the kinds of cancers that you see in Mindanao are going to be very different from the kinds of cancers that you see in northern or central Luzon. Because for us, we are very agricultural. We have lots of plantations. We have mining and all that. And in here in Metro Manila, you have exposure to pollution, you know. So every
your
place,
environment and your
particularly
lifestyle
yes, the
will impact
environment,
on.
the lifestyle is going to be very different, and the problems are going to be different also. Would you believe the fourth that if you look at Metro Manila, the population of Metro Manila, which is about 25 to 27 million, is the population of the whole of Mindanao. So Metro Manila, you know, it's very, very congested, but it also has the richest places, Makati and Quezon City. It has all the richest places. But if you go to Mindanao, which is huge, it also has the poorest provinces. So the problems, you know, we could not have a solution that fits everyone for this country. So we must have this information so that we can tailor make the kind of strategies that we're going to do for the rest of the country. And, you know, I would like to commend the Department of Health, despite all of the challenges of COVID. You know, COVID is really scary. And it's more scary for people who have cancer, because we're not only fighting cancer, we're also fighting COVID.
You can also actually say that they are intertwined because of being immunocompromised is part of the whole experience.
No, but if you come to think of it, the cancer patients are the most prepared for COVID because of the culture of having to wear masks, infection control, and all that. But unfortunately, because of, you know, the lockdowns and all of these things, we have delays for medicine. Our patients cannot come to the hospital. I think we're quite fortunate, a little fortunate in Mindanao, because we for the past 7 or 8 years, we have established shared care facilities or satellite facilities. So when Davao went into lockdown, our patients were able to access care in the shared care facilities. And you know, we were doing teleconsultations, like, you know, Zoom meetings, consulting specialists like myself on platforms like Zoom. But our patients were able to access care in those shared care facilities. And hopefully it's something that, you know, we can replicate in the rest of the country. We need to be more efficient. It's not just about money. It's how to use money wisely, and, you know, to put it where it's going to make lots of returns for patients with cancer.
Maybe we can ask Ms. Aus to share her experiences in terms of the challenges posed by this current scenario, given that the Cancer Coalition Philippines group has a lot of experience in being able to overcome all of these and come up with the strategies that we mention that adapt from place to place.
Yeah, the fourth, I found it interesting when you started off earlier by saying that cancer seems to have sort of quieted down because of the COVID. And the reality is there were a lot of things that Cancer Coalition, as well as its different member organizations, have been doing, simply because, as was mentioned by Doc May, cancer patients who are immunocompromised have a challenge of having to go to the hospital for their checkups or for diagnosis, screening, and everything that's required in terms of treatment and care. One of the things that Cancer Coalition and its members did was actually to establish support so that patients are picked up from their homes, brought to the hospital, and then brought back to their homes. And this included having PPEs, not just for, usually you have the cancer patient and a companion, but as well as the driver to ensure their safety. So this was a very practical and concrete action that in Metro Manila Cancer Coalition did, and in the Visayas Cancer Warriors did for our kid patients. But the other thing as well is that PSMO actually did research, the Philippine Society of Medical Oncology, among their various member physicians, and they reported that at least 70% of their patients who have cancer have experienced progression of disease, meaning mas lumala yung kanilang cancer because they were not able to access the necessary care. But at the same time, all of the medical societies have actually, in a sense, adapted themselves. And I think this was, in a sense, the silver lining, that we now have oral chemotherapy, which are actually couriered or delivered to patients' homes so that they don't need to go to the hospital. Or we have teleconsultations were set up by various oncology departments of hospitals that I will not name, but both public and government hospitals, as well as doctors themselves. And while there may be some constraints o parang nag-aalanganin pa na kaya ba akong ma-diagnose na nasa computer lang kami, over time, both patients and doctors, I think, have learned to maximize the technology and to be able to ask questions or do it in such a way that they are able to have an interaction that is very positive and very effective as well. On the context of the NICA law and why the coalition decided to push for that passage, we always say it was born out of frustration and passion. Frustration because actually we do have a number of administrative orders in terms of cancer. But unfortunately, because the situation in our country is that when there is a change of national leadership, there's also a change of department leadership. This has affected the implementation of this administrative orders, and that's why we felt that a law would be the best way para mas sustainable siya, mas tuloy-tuloy siya. And a major reason for that is actually that in terms of other countries in Asia, yung mga kapitbahay po natin, kanugnog nating mga ibang bayan, medyo mababa po ang survivorship natin. Ang ibig sabihin po, kayang gamutin ng cancer, kayang mabuhay sa cancer, pero dahil kulang po ang pera ng gobyerno at ng atin na ring mga pasyente, kaya po marami pa ang namamatay dahil ang reality po ay most often may tinatawag tayong pag nakita po ang pasyenteng may cancer, medyo advanced na. Pag nakita po kasi ng mas maaga, nag-uumpisa pa lang, mas mataas po ang tsansa na talagang malabanan ng cancer at makonquer yung cancer. Pero pag advanced na po, ito pag sa adults po, may mga staging na, medyo mas mahirap po. Pero ang isang mensahe rin po, hindi po ibig sabihin na pag sinabi sa inyong stage 3 or 4, mamamatay na kayo. Ang ating pong mensahe ngayon, lahat po ay kayang buhayin sa tamang gamutan at kung may tamang gamot na naibibigay. Kaya nga lang po, ang lumalabas sa Pilipinas, ang catastrophic po ang salitang ginagamit in terms of cause for cancer. Kasi po dapat 25% lamang, kumbaga sa piso, di ba? 25%, 25 centimos lang dapat ang galing sa pamilya. Sa piso, ang lumalabas po pag may cancer, 75 centavos po galing sa pamilya. Kaya po dahil doon, napakahirap po, kumbaga, ng gamutan sa cancer. Pero pwede po sanang mabuhay.
Yes, as a follow through with Ms. Carmen's thoughts, we have not really stopped. Kahit na a lot of hospitals have stopped elective admissions and all that. Cancer care has continued despite COVID. Siguro meron kaming 1 to 2 days na we tried to arm ourselves, provide PPEs, make sure that patient flow is efficient, but we've never really stopped kasi nga cancer will not wait for us. Cancer will not wait until COVID is over. So we are put in a position that we have to fight cancer and we have to fight COVID. And andito na tayo, no? So we have to adopt. So Ms. Oste's comments about the medical societies adapting ourselves, particularly on how we treat cancer patients, is true. One thing that I find a very good strategy is the law will strengthen comprehensive cancer care centers and specialty centers for cancer, because even if we try to do early detection, if we have no place to bring these patients, they would still end up in late stages of disease, right?
True.
So that's why, and I think this is how we can push the law forward by strengthening the health system and the places where these patients go to, so that more people will have access. And the thing with cancer care, the fourth, is that it improves the quality of care of hospitals, because it touches on so many things. Hindi lang siya oncology. There's radiology, there's surgery, there's radiation oncology. Actually, tinataas niya yung level of care of every hospital. And this is why cancer is really worth investing to. If you want a good health system for the country, and I'm not talking only about diagnosis and treatment, I'm also talking about public health. How do you prevent cancer, right? So in one sense, this is where the cancer law and the universal healthcare law, overlaps each other, because a lot of the programs of the Department of Health in trying to make people stop smoking, tobacco control, in promoting healthy lifestyle and good health for its population. It's part of a cancer continuum. It's prevention and early detection, and when you go into diagnosis and treatment. That's why not only the population-based but also the hospital-based registry is very important, so that we will know how bad or how good we are, particularly in measuring our outcomes in providing quality improvement for care. Kaya importante din yung registry ng hospital, because that's also a benchmark for us to see how good we are doing. And the population-based information is very important to inform policy.
I guess at this stage, it's good to address our messaging to both hospital administrators and officers of health department regional officials who would be involved in the implementation of policies and the coming up with the specific strategies in their respective provinces or regions. Because you did mention that by focusing on or adapting strategies for cancer care, actually raises the level of health care in the health institutions by virtue of the quality control standards required of cancer care.
The fourth, actually, the Philippine Cancer Center, which has been established by virtue of the law, has announced that there will be 14 basic comprehensive cancer centers in the various regions, and then at least 8 advanced comprehensive cancer centers. And as Dr. May was saying, this is where the integration of universal healthcare and the NICA law happens, in the sense that there will be a strengthening of not just the healthcare system, but even the capacities ng ating mga healthcare workers. And really, when we crafted that law, we made sure na covered yung tinatawag natin na cancer continuum, na nag-uumpisa yan mula sa health promotion or prevention. Kaya nga lang po, sa mga batang may cancer, wala pa pong prevention dahil hindi pa po alam kung anong dahilan. For adult cancers, pwede na po natin gawin yon. In fact, for cervical cancer, which is now the first cancer na pinaplano pong ma-eliminate sa buong mundo, kasama na po ang Pilipinas, meron po tayo ng HPV vaccine para po mabawasan ang likelihood na magkaroon ng HPV at cervical cancer. At for liver cancer po, sa mga sanggol, meron na rin po tayo nung vaccine against hepatitis, kasi po yung hepatitis B po ay nagiging sanhi din po ng liver cancer. And tuloy-tuloy po yan sa rehabilitation at reintegration. And that's the reason po, ang isa pong magandang aspeto ng ating batas ay yung ating pong mga cancer survivors, people living with cancer and cancer patients, ay marirecognize na rin po as persons with disability. And we're very thankful kasi ng NCDA kahapon ay nagkaroon po sila ng isang pagpupulong patungkol po dito. This is something that we would ask very much na talagang for able to accelerate, because this will be a very big help to our patients right now, especially in terms of the 24% discount for medicine. Kanina nagtanong ka, ano yung mga government offices na nalalapitan for assistance. Ang malungkot lang po is dati po, nandiyan po ang PCSO, nandiyan po ang DSWD, meron din pong no balance billing pag nasa government hospital. Subalit, ang latest feedback po namin, ang PCSO po, actually nung August, medyo natigil ang tulong for cancer patients. At ngayon naman po, ang sinasabi po nila ay January na po ulit magbubukas. And PCSO is a very big source of augmentation of funds. So for those who are listening in our government, IATF, our legislators, if there is a way that you can fund PCSO so that they can continue to support. Kasi yung maintenance medicines po nung ating mga breast cancer patients, prostate cancer patients, talaga pong nahihirapan sila kasi epektibo po pero medyo mahal. Pero before with PCSO, kaya nila. Ang DSWD po nakakatulong din po. Kaya lang po yung dati na mga 25,000, naging 10,000, 5,000. So pagdating po kasi sa gamutan, lalo na po sa adult cancers, medyo hindi po sapat ang 5,000 o 10,000. Sa mga batang may cancer, okay po yon in terms of the maintenance medicines. But for adult cancers po, magamot po nila ay mga 40,000 to up. And so kailangan po nila niyan. We're glad to note and we're very thankful the senators have opened online assistance for cancer patients, as well as the Office of the Presidential Spokesperson and the NCDA. So grateful po kami when we inform them na medyo kulang na po or wala na ang tulong mula sa PCSO at sa DSWD, nag-step in po sila. And this afternoon po, meron pong pagpupulong kay Senator Bongo tungkol naman po kung paano ang malasakit ay lalo pang ma-strengthen and ma-expand. Pero sa
You're referring to the malasakit centers of that's spearheaded by Senator Go.
Bongo, but unfortunately po, right now they're also not open to assistance in most areas. So, but yes, agreed to meet this afternoon with representatives of Healthy Philippine Alliance and Cancer Coalition, and so we will be bringing this up, and we're very thankful for that as well.
Can we go back to the discussion regarding the Cancer Assistance Fund? Because I guess, is that something that people can resort to?
Sa Congress kasi, yung Cancer Assistance Fund natin was not funded. The Senate Finance Committee has now recommended na magbigay ng starter fund of at least 500 million. And my commitment, si Lord, that when they meet as a BICAM, that is something that they will support. Ang Cancer Assistance Fund po will be accessed by patients in need, not just for medicines, but also for practical support like transportation, food, etc. Pero sa ngayon po, hindi pa po natin natitiyak kung itutuloy po ang suporta mula po sa Senado at sa BICAM. So hinihiling din po namin in behalf of our cancer patients and families na sana po ituloy nyo na po na magkaroon po talaga nung initial allocation of 500 million. Actually, kulang na kulang pa po yan kung iisipin dahil nga po, limbawa, may mga gamot po tayo, 90,000 to 100,000 a month na tuloy-tuloy kailangan ng mga pasyente for certain kinds of maintenance. Pero kung yun po ay maumpisahan, nagpapasalamat po kami. Meron din pong another 500 million na iniisip nila na para lamang po sa medical assistance program. At isinama po namin, recommend din po namin, mahalaga po kasi yung tinatawag nating palliative care or psychosocial support, kung saan meron po tayong patient navigator or gabay na sumasama sa pamilya para po matulungan sila in every step of the cancer journey. So may hinihiling din po na mga 60 million para doon at sana po ay masuportahan po yon ng ating mga buting senador at congressman sa kanila pong BICAM.
The fourth, for me, my views are very simple.
Okay.
Ano yung best chance ng cancer patient? It's to be diagnosed properly and to complete treatment. Alam mo yon, yung yung to be diagnosed correctly and to complete treatment. So in terms of funding, kailangan this has to be provided, because that's the spirit of the law. How can we increase survivorship if and it has to be in the context na ano siya, that's why I'm saying that one of the challenges is really a fragmented healthcare system. Kasi kung tutuusin, I think a lot of things are already in place. Hindi lang siya na ma-maximize. And what Ms. Oste and the Cancer Coalition, I think that will be a lot of help for us kasi marami naman talaga ang may cancer sa bansa, right? In fact, sinasabi natin na 500 million, that is not even enough. But I feel, for me, I feel that if we use all of our resources, if we are able to harness the system in such a way that it becomes efficient, so siguro we can remove duplications, we could monitor, kasi hindi lang naman yan siya getting money, it's also governance, no? And efficiency. I think that's very, very important, kasi nga, bibigyan tayo ng pera, we have to be responsible for it. But siguro mas ma-maximize and mas ma-enrich natin ang experience ng bawat bata o matanda na may cancer if we have an efficient healthcare system. And I think the Department of Health has a lot of work to do in that area. Kasi for example, like halimbawa, if we request a lot of medicines and hindi siya na-distribute, remember we are an archipelago, no? Lahat sila nasa Manila. What about yung nasa Visayas? How do you get the medicines to people in the Visayas or to people in Mindanao? Kaya nga paminsan-minsan na-delays because of we can't efficiently provide these medicines. Kasi we're not just talking of people in Metro Manila. We're talking about people in the rest of the country.
Yeah, so there are communities in islands and
although the Fort, we
haven't seen a doctor.
The Fort Locme, we had a recent good practice model. Kasi if you recall, yung mga lupus patients natin nag-iiyakan dahil hindi sila makabili ng HCQ dahil ito yung dati ginagamit para sa COVID. Pero ang nangyari, even if we're cancer warriors, tinulungan po namin sila, humiling po tayo sa Department of Health. Ang short story po, nagkaroon po tayo ng mga medicines. Ang ginawa po namin, kinukurir po yung diretso sa bahay ng mga pasyente. So, all the way po hanggang Zamboanga dahil walang basilan, hindi lang po narating at that time, Batanes. So, meron po tayong pamamaraan na ngayon na maski tayo yung mga isla, ay maaring makakarating yung mga gamot na kailangan. Yung pagdating naman po sa gamutan, that's the reason why, if you notice po, yung letter I ng NICA is Integrated Cancer Care. Kaya nga po, ang rene-recommenda ay magkaroon po tayo ng National Cancer Council na sa ngayon po ay hindi pa po binubuhay, na sana we request the DOH and the Office of the President kasi nandun na po lahat ng mga nominees na sana po ibuhayin na ito because sila po actually ang magsasagawa ng plano at pulisiya para yung binabanggit ni Doc May na integration, hindi pagkakawatak-watak, at yung tinatawag po natin na malinaw na pathway ng cancer patient. Mula po sa ating RHU, papunta po sa district, papunta doon po sa mga basic and advanced comprehensive cancer center. Sa ngayon po, may iba po tayong LGU, malinaw na po ang pathway nila. At dahil po doon, maganda po ang nagiging resulta para sa pasyente. Pero meron pong iba na hindi pa. At bahagi din po niyan ay that we strengthen our rural health units. COVID has showed us that the barangay health officials and their teams can actually do so much in terms of our healthcare. So sana po, in terms of cancer, nakabahagi po ito both sa universal healthcare and sa NICA, na lalo pa po nating patatagin at suportahan po natin yung ating mga primary healthcare para yung iba pong kailangang gawin ay doon na po mangyari, be it in terms of health promotion or early diagnostics. And then after that, yun naman pong ating mga ospital na in-identify na ng Philippine Cancer Center ay lalo pa rin ma-strengthen. But the fourth, I'd also like to bring in that cancer care is not limited to hospitals and health facilities. Cancer care happens in our communities and in our workplaces. Kabahagi po ng batas na dapat po ang ating iba't ibang mga kumpanya, lalo na po yung malalaki, ay magkaroon ng cancer policy. Pareho po nung ginawa sa HIV/AIDS. Para po yung ibang mga early screening doon po sa mga malalaking mga kumpanya ay maisasagawa na nila doon. At in effect, sila po ay magre-refer ngayon dun sa ating mga ospital. Pero ang isa pang napakahalagang I'd like to bring up the fourth na oftentimes nakakalimutan pag pinag-uusapan ng cancer is nakakaranas din po ng discrimination ng ating mga pasyente. Both those ongoing, those who have survived, at even ang mga pamilya nila. Kaya sa batas po ngayon, ipinagbabawal ang discriminatory practices against those with cancer and their families. Ano pong sample nun? Ikaw, halimbawa, the fourth, wag naman sanang mangyari. Nagkaroon ka ng family member na may cancer. Alam mo ba sa ibang kumpanya, yan ngayon ang basis, hindi ka na ipopromote or hindi ka na ipapadala sa training. Or kung ikaw naman ay cancer patient na empleyado at nag-survive ka naman ng cancer, biglang na-freeze ka na lang kasi ang tingin nila you're at risk. Or dati, nung meron pa tayong piece-to-piece, sabi nga ni Secretary Biones sa ating mga eskwelahan, alam mo bang may mga batang hindi tinatanggap dahil ang tingin sa kanila, quoting ang isang principal po, ito'y baka daw matigukang bata. So ito po ang mga discriminatory practices na nangyayari na ngayon po sa batas ay sinasabing hindi na dapat ipagpatuloy at hindi na dapat gawin.
So it's not so much that they're concerned of overly stressing yung student o yung worker, pero talagang pinipigilan yung kanilang growth development.
Yes, and there are some fears kasi of some parents, they see cancer as parang HIV/AIDS na nakakahawa. Kaya bahagi po ng mensahe, hindi po infectious disease, hindi po nakakahawa. Kung baga siya po ay may cancer, siya ay kailangan ng suporta at ng assistance ng lahat. And even if HIV/AIDS yan, ganun din po yun, na kailangan din po natin sila ikalinga, kumbaga, at suportahan.
That's the beauty of the NICA law. No? Kaya siya tinawag na comprehensive. Because it's not only clinical care, but it's also education, it's also research. And you know, if our cancer program is going to be very successful, what is the measure of a good health system? It's actually a people who is healthy, not people who are sick, right?
Yes,
kung halimbawa marami tayo lahat, healthy tayo lahat, what's the best foil against cancer? It's not to have cancer. So if we have a very successful public awareness, public education, and all of these things in our our people, that's why I think the bigger message of the NICA is that, of course, cancer is a tough disease to defeat. But it's not all. It will not only be based on government alone. It's the work of many people, the work of Cancer Coalition, the work of doctors, the work of lahat of us taking care of ourselves, not getting cancer. So I think for me that's one of the big messages of the NICA law. No, of course it's the responsibility of government to provide all the necessary care and treatment and even avenues to encourage a healthy population. But may part din tayo doon.
That's a good point, actually.
We are part of the solution. We are part of the solution.
Definitely. And that's the reason why even when we were crafting the law, Doc May, as you know, we involved all stakeholders, even the industry, even pharmaceuticals. And I'd like to inform you that there are ongoing discussions between Cancer Coalition and a number of pharmaceutical companies na pag ang gobyerno ay hindi mapondohan yung Cancer Assistance Fund, na wag naman sana mangyari, we have engaged with private sector and even the pharmaceuticals for them to be able to donate funds para maumpisahan po natin yung ating Cancer Assistance Fund. Dahil sabi nga natin, cancer patients cannot wait. So definitely po, tulong-tulong po tayo lahat. Pero at the same time, meron pong accountability ang ating pamahalaan. Yun lang naman po ang mensahe. Hindi po namin sinasabi na ang pamahalaan lahat ang sasagot ng kinakailangan ng mga pasyenteng may cancer at iba pang sakit. Pero pag titingnan po natin ang budget po na inallocate for health ay mga 7% lang. Sa ibang mga kanugnog na bayan natin na medyo kasing hirap po natin, umaabot naman po sila ng 9 to 10%. Sa medyo mas mayaman-yaman, 13 to 18%. So yun lang po, kung madagdagan po ang kabuang budget po para po sa health, madadagdagan din po ang para sa cancer at sa iba pa pong non-communicable disease. Yun lang po
Yeah,
ang
of course,
panawagan.
government has to show example by putting money into the cancer assistance fund, because that's government's responsibility, and government should do that. No, so that kasi ang ano ko rin is really, that's why I keep going back to having a cogent or a cohesive health system, kasi useless yan eh. If you diagnose a patient with cancer tapos walang gamot, you already waste money on the diagnosis. So that's wasted resources in a country with very limited resource.
And reality, di ba, Doc May?
But if you invest in cancer, huwag mo isipin na cancer yan, it uplifts the health system. Kasi the training that the nurses get, that radiology or imaging get, hindi naman yan pipiliin na yung knowledge ko for reading x-rays para lang sa cancer. No, that's for all patients. Sa pathology, when you are very good in diagnosis, it's not the discipline is not only for cancer, it's for everyone. So ang daming secondary benefits of investing in cancer. And
kaya mapapansin mo, pag binasa mo yung batas, yung multidisciplinary na salita ay makikita mo more than 10 times. Kasi nga, pag sinabi mong cancer, complex yan. Kung yung anak ko pa, tanungin mo, sinong doktor mo? Tatanungin niya, anong parte ng katawan? Kasi specialized, di ba? So iba yung sa brain, iba yung para sa iba pang mga proseso ng kanyang ganun din po sa ating iba't pang mga cancer patients. Kaya nga, pag ating pong in-strengthen yung cancer system, actually, it is strengthening the whole health system.
Yes, and I think that is the big message that our lawmakers and people who are responsible for budget, should receive. That when you put money in cancer, you actually uplift the whole health system. No,
the universal health care.
Yes, and if we become very, very successful, we will move towards not treating cancer but preventing cancer. And what is the effect of that? You have a healthy population, right?
True. What that clarifies is that the universal health care system is what is the one that also benefits from focusing on better cancer health care.
Yes.
Kaya lang po ginawa ang NICA, even if there was already UHC, kasi ang karanasan po ng ibang bansa, maski may universal healthcare law ka, kung wala ka ring cancer law, medyo napupunta po sa likod at hindi nabibigyan ng sapat na atensyon yung cancer. And if you notice in the law, nabinggit nga ni Doc May, madami doon is in terms of ano yung mga specific elements na kailangan mo para mas madami kang masave at kumbaga at talagang matulungan yung ating mga pasyente.
I think another good point that you both brought up is that while the government is the lead in of the universal health care and cancer strategies in the country, it's not something that the government does alone, and all stakeholders, particularly the private sector, is also key in being able to win the battle against the disease.
And I also, the court, binring up sa amin ng aming mga abogado na kasamahan din natin sa cancer community. We're one of the few countries kasi nakalagay talaga sa constitution natin na ang ating gobyerno ay kailangang pangalagaan ang kalusugan ng ating mga kababayan. At ito ay hindi lamang isang pribilehiyo, but health is a right na lahat tayo ay mayroon. Kaya naman, kumbaga, even if pwede namang sabihin, halimbawa ni Cancer Coalition, sige, private support na lang yan. But that is the reason why talaga pong hinahabol pa rin po natin ang tulong at ang accountability from government. Dahil bahagi naman po yun ng pinanumpaan nila sa ating mga kababayan. Di po ba? And the other thing that we often forget is, halimbawa po, yung batang nag-survive ng cancer, alam niyo po ba, 71 life years pa po yan na mabubuhay. Yung sa adults po, kumbaga nadodoble pa, yung lalo na sa mga bata-bata pa. So hindi po totoo yung pag may cancer, maiksi na buhay, ba't mo pa tutulungan? Hindi po. Mahaba pa rin po ang buhay ng may cancer. Maski po yung stage 4, merong iba, 10 taon na buhay pa rin. So wala po yun sa numero. Lahat po ay pwedeng gamutin, depende lang po. So ang sinasabi po sa mga stage 4, hindi po siya curable pero treatable. Kaya pang gamutin pero hindi na kumbaga totally na mawawala.
But still, there is quality of life that can be achieved.
Definitely.
Yeah,
Definitely.
and also the view na, kasi iniisip natin paminsan-minsan na, halimbawa, pag stage 4, wala, you can't do anything. One of my realizations, the fourth as a pediatric oncologist, and, di ba, pag sinabi mo paminsan-minsan oncologist, parang ang lungkot. parang napakalungkot. And a lot of people are asking me, bakit ka nag-oncologist? And ang training ng doktor is, you want everybody to be well and to be alive. And, you go into a specialty that death is one of the things that you would have to accept. But you know what made me very fortunate and feel very privileged to be an oncologist? Because when care is no longer, when cure is no longer possible, you know that you can shift your goals into care. Kahit stage 4 yan, alagaan mo pa rin yan. You can give them a good quality of life and a dignified death if possible. And particularly for children, malaking bagay po yan. And iniisip natin, and lalo na sa country natin, there are so many people na hindi man lang na-diagnose, namatay lang sa bahay. Don't you think that is so unfair?
True. Maybe we can help people with a little bit more of information. What do people do? Who can they approach and the kinds of help na pwede nilang ma-expect from?
So as Ma'am Carmen has earlier mentioned, we have designated comprehensive cancer care centers across the country. And then we have 14 regional centers. So hopefully, kung magkaroon ng pera yung Cancer Assistance Fund na yan, and if Department of Health, helps us, we can, we could strengthen this facility so people can go to these places to be diagnosed and to receive appropriate care. No? And the good thing, you know what, meron tayong lung center, meron tayong heart center. For the first time, we're going to have a Philippine Cancer Center. Ngayon, management office pa lang siya, but that was never there for a long time. And cancer used to be just a program under non-communicable disease. Kumbaga, akalain mo isang program manager lang sa buong bansa, cancer ang in charge niya. Now, one of the things that this law has provided is a division for cancer. Now, the focus, kaya there is failure implementation kasi nga, there is lack of focus. So what the law has done is to give focus to cancer and to provide the necessary manpower, hopefully the necessary things that we need so that we could improve the survival of Filipinos with cancer. So
Doc May, we'd also like to share with you and the fourth. Pangatlong araw na po ngayon, meron po tayo nung tinatawag nating On Connect, gabay sa pasyente. So maaari po silang mag-text o tumawag. Ang number po ay 0917-593-6916. At kanina po, binuksan na rin, meron na rin po itong Viber at Messenger. So para po ito sa ating mga pasyente, kung may mga katanungan po sila, saan po sila pwedeng pumunta, ano po yung may mga ospital po kasi tayo na may free diagnostic services, may mga ospital po tayo na may online consultation, at ganun din po, gabay din po sa kung sino ang pwedeng lapitan para humingi ng financial support at ano ang mga requirements nito. So Lunes hanggang Biyernes po, 9 to 5, meron pong sasagot at may makakausap sila at pag Sabado naman po ay kalahating araw. So yan po ang isang inumpisahan pa lamang po ng Cancer Coalition at ng Philippine Society of Medical Oncology and also Philippine Society of Pediatric Oncology ay ibinahagi na rin po ang mga pangalan ng kanilang mga doktor at kung nasaan sila. Kasi meron pong iba na nagtatanong, lumipat kami ng bahay, nandito na kami, nasan bang ospital na malapit? Yung mga ganong tipo po. So, on-connect gabay po para sa pasyente.
Ms. Auste, could you please share with us again the number para we can flash it on our screen?
0917-593-6916. On-connect
Yes.
gabay sa pasyente or on-connect gabay. Meron po din yan sa Viber at sa Messenger.
So yes, this is for all the inquiries for help
Yes.
and kung saan pwede sila ma-direct in terms of and their questions at lalo mas ma-facilitate nga yung kanilang cancer care.
Apo.
So for concerned citizens and for the corporate social responsibility programs of corporations and enterprises, you can contact the Philippine Cancer Society. We're showing you here now their QR code for you to be able to get in touch and get information in order for you to contribute and show your support for the Philippine Cancer Society, including this can be anything from dealing with medical needs or educational and even emotional support, because component of course na any kind of medical condition is yung ating mental health. So Dr. Dolenda and Ms. Auste, is there any particular message you'd like to impart on our viewers?
Ang cancer po ay hindi madaling sakit, pero kayang gamutin, kaya pong mabuhay ng ating mga pasyente. Sa level po ng ating mga community, kung may mga kakilala po tayo na may mga cancer, ang kanilang miyembro ng pamilya, sana po ay buksan natin ang ating puso, lalo na sa ngayong malapit na po ang Pasko. Marami po sa kanila ay hindi po iniisip ang Pasko dahil nga po hirap na hirap sila ngayon sa kanilang gamutan. For our legislators and political leaders, we ask that the budget for the Cancer Assistance Fund as well as the Medicine Assistance Program be fully supported and enacted. We ask that the Integrated Cancer Council be activated, and sana po tuloy-tuloy na bukas ang inyong mga opisina sa pakikipag-usap sa Cancer Coalition, sa mga societies at sa Healthy Philippine Alliance para po matiyak natin na ating pong maprotektahan, ma-safeguard at tulungan po natin na humaba pa ang buhay ng ating mga pasyenteng may cancer. Maraming salamat po sa inyo rin sa Manila Times sa inyong ibinigay na panahon para sa pagpapalinaw at pag-uusap tungkol sa challenges at hamon ng cancer ngayong COVID.
Also, Ms. Auste, it might be good to note to our people in authority that our cancer patients are also voters, and their family members are also all constituents who would be, of course, be able to express their support for the kinds of leaders who do focus on health and welfare ng kanilang constituency.
And even more importantly, that our cancer patients and survivors, once they are cured of their disease, can actually become productive citizens. Yeah. We actually have a key member of the Philippine Cancer Society, whom I'm proud to say is a childhood cancer survivor. And the same for other types of cancer. Pag gumaling na po sila sa cancer, you can be assured that you have productive citizens with meaningful lives.
Yes, thank you very much, Ms. Carmen Auste, the Vice President of the Cancer Coalition Philippines.
I would just like to, first of all, thank Coffee Break for this opportunity to share our thoughts with regards to the cancer care landscape of the Philippines. And for everyone, I think we should never lose hope. We have a long way to go. Ang dami nating kailangang gawin, ang layo ng tatahakin. But having the Republic Act 11215 is a step in the right direction. Always a successful journey depends on taking the right steps towards the right direction. And I believe this is what RA 11215 or the National Integrated Cancer Control Act has given us. So thank you very much. This is not going to be just the work of government, but everyone is necessary in this advocacy and in this work. So we invite everyone to participate And of course, we call on government, and particularly the Department of Health, to fix our fragmented healthcare system so that we can efficiently deliver care to the Filipino people.
Panawagan tayo sa mga LGU na sana po meron po tayong mga pondo na ilaan para sa ating mga pasyenteng may cancer at ganun din po yung ating mga RHU and CHO. Sabi nga po ni Doc May, tulong-tulong, sama-sama sa paglaban sa cancer. Buhayin po natin ang ating mga kababayang may cancer.
Yes, thank you, Ms. Carmen Auste, and to Dr. May Dolendo, the head of the Children's Cancer Institute. This has been the Manila Times Coffee Break, strategizing for better cancer care. Thank you and good day.